This tape is intended as a quick guide to new medicine by Dr. Med Ryke Geerd, especially about the topic of cancer. It is intended to provide a quick introduction to the topic and is intended as a supplement to the books by Dr. Hamer, Cancer, Disease of the Soul and Legacy of a New Medicine, Volume 1, The Ontogenetic System of Tumors with Cancer, Leukemia, Psychoses, and Epilepsy. Dr. Hamer, how did it actually come about that you became involved with the topic of cancer and even thought about the connections between the soul and diseases?
Until 1978, I had not really dealt with this topic. I was an internist, had worked at university hospitals for 15 years, had taught students as a lecturer for 5 years, and I was a normal internist who also had some years of practice. Until 1978, as I said. Then something terrible happened. Because a wild-running Italian prince shot my son Dirk, without any reason, who was sleeping in a boat. That was a shock that caught me completely unexpectedly, as we say, caught me on the wrong foot. A shock against which I was powerless and could not react. Normal conflicts and events do not hit us so shock-like, but we always have a little time and opportunity to prepare ourselves. These are the normal problems, conflicts that we have. On the other hand, those conflicts for which we cannot prepare, those which hit us shock-like, we call biological conflicts. And so in 1978, I fell ill, with such a biological conflict, a so-called loss conflict with testicular cancer. And at that time I thought, because I had never been seriously ill before, that this testicular cancer must have had something to do with the death of my son. 3 years later, I had the opportunity to work in a gynecological cancer clinic at the University of Munich, where I worked as an internist and I examined my patients to see if the mechanism worked the same way for them as it did for me. In other words, whether they had also had such a shocking experience of conflict as I had. And I found out, yes. All of them, without exception, had had such a shocking experience, and from that moment on they had cold hands, had lost weight, had not been able to sleep at night, and we could reconstruct that cancer must have grown from that moment on. At that time, this view was so completely against all conventional medical ideas, that when I presented this view to my colleagues, I was immediately faced with the alternative of either leaving the clinic immediately, or swearing off.
That sounds like the Middle Ages. And how did you react in this situation?
Of course, as a Frisian you cannot abjure, especially since I should have abjured without any counter-argument, against my better knowledge, but I left. I suffered a biological conflict during this expulsion, or to be more precise, a huge loss of self-esteem. I can still remember that very well. Because I found it such an outrage that I was expelled from the clinic because of a well-founded new scientific finding that was irrefutable. I would never have thought this possible before. It was very dramatic, because I was able to examine the 200th patient until the last day, and the so-called iron rule of cancer was born on the last day.
Perhaps you would like to tell us briefly and in a generally understandable way what the essential criteria of the iron rule of cancer are?
The iron rule of cancer is a biological law. It has 3 criteria. The first criterion is, every cancer or cancer-like illness develops with a Dirk-Hamer syndrome, DHS. This means a very severe, highly acutely dramatic, and isolating conflict experience shock. Simultaneously or quasi-simultaneously on 3 levels. First, in the psyche. Second, in the brain, and third, in the organ. DHS is the Dirk-Hamer syndrome. I named it that way because I myself was diagnosed with testicular cancer after the death of my son Dirk, during the shock experience. Since then, this DHS has become the linchpin of the entire new medicine. Because we must now conscientiously try to reconstruct the DHS with all its trappings in every case of illness. We have to try to put ourselves in the specific situation of the time. Only from the situation at that time can we then understand why this problem hit someone as a biological conflict, why it was so dramatic, why the person concerned was isolated at that time or had no one to talk to about it, and why the problem was conflictive. This means that the person in question either could not decide between 2 options, or had no opportunity to react to the problem at all. A good doctor must be able to put himself in the mind of an infant, even an embryo, an old man, a young girl, or even an animal. At the same time, he must also be able to put himself in the current situation of DHS at the time. Only in this way can he find out the difference between a problem, of which we have hundreds, and a biological conflict.
But the iron rule of cancer has two more criteria.
Yes, the second criterion is, the conflict content determines at the moment of the DHS both the localization of the Hamer focus in the brain, as well as the localization of cancer or the cancer equivalent, that is the cancer-like disease, on the organ. There is no conflict as such, but each conflict always has a specific content. This content is defined in the second of the DHS. The content of the conflict arises associatively, which means through involuntary thought allocation and mostly past the filter of our mind. For example, a typical water or fluid conflict is, a tanker truck driver has an accident that causes the oil tank to leak, or a dairy driver has the entire milk tank leaked. This is associated with water or liquid and therefore causes a biological conflict, or water conflict for short, with a certain type of kidney cancer.
This means that every conflict content has a specific type of cancer, and a specific place in the brain?
Yes, a very specific relay in the brain. In the case of our kidney cancer, with a water or fluid conflict, depending on whether it is for the right or left kidney, a predetermined location in the brain is short-circuited at the second of DHS. This short circuit can be photographed with our computer tomographs. This place looks like the concentric rings of a target, or like the image of a water surface, into which a stone has been plunged. This phenomenon has always been misinterpreted by radiologists as an artificial product or artifact of the apparatus. Such a modified relay is called Hamer focus. However, the term was coined by my opponents, who had called these places I had discovered, the strange Hamer focus.
And what is the third criterion of the iron rule of cancer?
The third criterion is, the course of the conflict corresponds to a certain course of the Hamer focus in the brain, and a very specific course of cancer or cancer-equivalent disease in the organ. This can be summarized. This means that this biological conflict occurs on three levels: in the psyche, in the brain, and at the organ quasi-simultaneously. It is now obvious and can be proven at any time in the next best case, that the course of the conflict, or rather the disease on all three levels, is synchronous. If the conflict can be solved, we also see the change through this solution on all three imaginary levels, synchronously. That is, they are running parallel. And the subsequent healing process is also synchronous on all three levels. This is a so-called overdetermined system in the strict scientific sense, whereby, if you know one level exactly, you can open up and find the other two levels. This means that we have an organism that we only think of in three levels, but which is a unity. A small example of this. After a lecture near Vienna, in May 1991, a doctor brought me a brain-computer tomogram of a patient and asked me to tell the other 20 colleagues present, including several radiologists and computer tomogram specialists, what organ findings the patient would have in the associated conflicts. So I had only one level, namely the brain level of our imaginary three levels. I diagnosed from the CT of the head, a freshly bleeding bladder carcinoma in the healing phase, an old prostate carcinoma, diabetes, an old bronchial carcinoma, and a sensory paralysis of a certain area of the body, and of course the corresponding conflicts. Thereupon the doctor stood up in front of all colleagues and said, "Mr. Hamer, congratulations. 5 diagnoses, 5 bullseyes. That is exactly what the patient has. And you can even distinguish between what he has now and what he had before. Fantastic." One of the radiologists said, "As of today, I am convinced of your method. After all, how could you guess a freshly bleeding bladder carcinoma? I had evaluated the CT with no findings. But after they showed us the relays, I can understand their findings."
Maybe we can stay on the psychological level for a moment. How can I find out whether I suffered such a shock, which then causes corresponding cancer? How can you recognize this?
Yes, there are very precise characteristics that are very different from the normal conflicts and problems that we have all over the country every day. Because, exactly from this DHS on, the patient has a so-called permanent sympathicatonia, permanent stress. That means, he has very cold hands and feet. He no longer has appetite, loses weight, he can no longer sleep at night, he thinks day and night only about his conflict. And this state does not change again, until the patient has resolved this conflict. So in contrast to the normal conflicts and problems, we see with these biological conflicts that the patient gets into permanent stress. He makes very specific symptoms. So apart from the growth of cancer and this Hummer focus in the brain, which we can see from the first second in the brain, the patient has psychologically well-known defined symptoms that cannot be overlooked.
So what happens when such a biological conflict is resolved?
In this case, we see again very clear symptoms on the psychological level, on the level of the brain, and the level of the organs. On the psychological level and the vegetative level, we see that the patient suddenly no longer thinks about his conflict day and night. He suddenly gets very hot hands, he gets good appetite again, sleeps well again, gains weight again, which he had lost in the conflict-active sympathicotonic phase. However, he becomes very weak and tired, sometimes he can only lie down. However, this is by no means the beginning of the end, but a very positive sign. This healing phase takes different lengths of time, depending on the length of the previous conflict. About as long as the conflict lasted. At the climax of the healing phase, in which the body has stored a lot of water, we see the epileptic or epileptoid crisis, with different symptoms for each disease. From this crisis on, the body excretes the edema water and slowly returns to normal. At the same rate, the patient notices that his or her strength is slowly returning. And at the brain level, parallel to this, during the healing phase, we see that the Hummer focus, which had a shooting target configuration in the conflict-active phase, is now getting edema. That is, it turns dark, and the rings in the computer tomogram become blurred and dark, and the whole relay in the brain swells up considerably. The epileptic, or epileptoid crisis just mentioned, which is triggered by the brain, marks the climax of the edema there as well, or the transition point back to normality. During the second half of the healing phase, harmless brain connective tissue, so-called glia, is stored in the brain to repair the Hummer focus. This completely harmless brain connective tissue, which we can stain white in CT with an iodine contrast agent, was previously often wrongly regarded as a so-called brain tumor and operated on, in complete ignorance. The brain cells themselves can no longer multiply at all after birth. Therefore, real brain tumors cannot exist at all. On the organ level, we now see what was previously considered the most important thing, that cancer no longer grows. This means that with the conflict resolution, which we call conflictolysis, with the beginning of this conflict resolution of the biological conflict, the cancer growth stops as well. And this is a very important finding, which at the same time pre-programs the therapy, so to speak. We also see very specific repair processes at the organ level, which we will discuss in more detail later. The epileptic crisis also occurs on the organ, together with the corresponding phenomena on the other two levels.
Could you describe what an epileptic crisis like this is?
The epileptic crisis is a process that Mother Nature has practiced for millions of years on us. It occurs on all three levels simultaneously. The purpose of this crisis, which occurs at the peak of the healing phase, is to return to normality. What we usually call an epileptic seizure, with muscle spasms, is only one special form of epileptic crisis. Namely, the one after the resolution of a motor conflict. Epileptic-like, that is, epileptoid crises, however, are found to be somewhat different for each disease, in principle, for all diseases. Mother Nature has come up with a trick for this important process. In the middle of the healing phase, the patient experiences another physiological conflict recurrence. This means that each patient is confronted with his or her conflict for a short period, which means that he or she enters the stress phase for a short time, gets cold hands, is centralized with cold sweat, and experiences all symptoms of conflict activity again, for a short time. The purpose is, as already mentioned, to squeeze out and excrete the brain edema and to return the patient to normal. After the epileptic crisis, the patient will warm up again. The patient then experiences the first small phase of urinary flow. From the epileptic crisis onwards, the patient is on the direct path to normalization. This means that once the patient has overcome this crisis, nothing exciting or bad usually happens anymore. At the end of the healing phase, the second phase takes place, namely the great urinary flood phase, also known casually as the peeing phase, where the body eliminates the remaining edema. The dangerous point is right at the end of the epileptic or epileptoid crisis. This is where it becomes clear whether the epileptoid crisis has been enough to turn the wheel. The best known epileptic crisis is the heart attack. Other epileptoid crises are, for example, pulmonary embolism, the hepatitis crisis, or the so-called pneumonia crisis. For the body to manage the change, of course, we support it in severe cases with a strong injection of cortisone, that is when the conflict has lasted a long time. In very severe cases, the cortisone can also be given in advance.
Maybe you can give us some typical conflicts as an example. And what else I think would be interesting, why do you call them biological conflicts?
We call them biological conflicts because they are to be understood in terms of developmental history and can be found analogously in humans and animals, and they are also analogous. They have nothing to do with the problems and conflicts that we otherwise have, with the intellectual psychological conflicts. They are conflicts of a fundamentally different quality. They are disturbances in the archaic behavioral program of our brain that are quasi-planned by nature. We think that we think. In reality, the conflict has already started associatively within seconds before you even start to think. For example, if the wolf robs of the sheep mother a cub, then the sheep mother suffers a mother-child conflict, just like the human mother. The sheep mother will suffer her suckling cancer on the same side as the human mother suffers from her breast cancer, depending on whether she is right or left-hoofed, or left or right-handed. At the same place where the relay for mother-child behavior is at the mother, and the disturbance of the Hummer focus for the mother-child conflict, or the nest area conflict. In the infant, the relay for the child-to-mother relationship, especially the sucking behavior, and in the case of a disorder, the Hummer focus for the child-to-mother conflict, is at the same place. We can classify all our biological conflicts in terms of developmental history. We know when the respective specific behavior patterns were developed and programmed in terms of developmental history. Therefore, there are not only organs and brain areas that belong together, but also conflicts that are entwined historically. All psychologically related disorders are, as already mentioned, closely related in our brain, and they are also organically close together, in terms of developmental history, and they have the same histological cell formation. We see a wonderful order of nature when we learn to look at the behavior of our organism from the perspective of developmental history.
Could you perhaps give us a few examples from everyday human life?
Yes, suppose a mother has her child by the hand, stands on the sidewalk, and talks to a neighbor. And the child tears loose, jumps into the street, and the brakes of a passing car screech. The child is hit or run over. The mother hadn't expected anything of this kind and is now suddenly caught cold, at the wrong foot. She freezes in fright. The child is taken to the hospital, perhaps in danger of death for days. The mother has ice-cold hands, can no longer sleep, can no longer eat, is in constant stress. And from that moment on, a lump begins to grow in her left breast, if she is right-handed. She suffers a typical mother-child conflict with shooting disc configuration in the right cerebellum. Now, when the mother can bring her child home from the hospital and the doctors tell her, well, that went off quite well and the child is now healthy again. From that moment on comes the conflict resolution phase. The conflict is resolved. From then on she has warm hands again, can sleep again, gains weight again, has a good appetite. This is a typical conflict process, which is virtually the same in humans and animals. Another example. A woman catches her husband in bed with her best friend. She suffers from a sexual frustration conflict. In biological language, a conflict of not being copulated, with a cervical carcinoma on an organic level. If the woman is right-handed. In the same situation, however, the same conflict does not necessarily result in every person. Because, if the woman had not weighed her husband anyway, and had long since thought of divorce, Then she feels this catching in flagranti, not as a sexual conflict, but at best as a human conflict of lacking solidarity with the family. This conflict would be a partner conflict, and would cause breast cancer in the right breast if the woman is right-handed. From a psychological point of view, the same event, with different psychological constellations, is only seemingly the same, but in reality, it is completely different. The decisive factor is not only what happens, but how the patient experiences it psychologically at the moment of DHS. The same event could in this case also cause a fear-disgust conflict with hypoglycemia, which means low sugar of the blood. If the woman had discovered her husband in a very ugly situation, for example with a prostitute, or it could trigger a self-devaluation, with or without sexual conflict, if the woman had discovered her husband with a girl, 20 years younger. The feeling would then have been something like, yes, I can't keep up with that, I can't offer him that. In such a case, the pubic bone of the pelvis would be affected in the skeletal system, where osteolysis, that is, decalcification, would appear as a sign of sexual self-devaluation conflict. All these things need to be known, to find out what the patient was thinking at the moment of DHS. Because in this second, the track is laid, on which the disease will roll as it progresses. This track is a very significant image because all possible later setbacks and recurrences, all run again on this track that was once laid. We can literally speak of an allergy to conflict.
Dr. Hamer, is it possible to treat a patient with the iron rule of cancer?
In principle, yes. But the iron rule of cancer is only the first biological law of new medicine. But there are a total of 4 biological laws that I have found empirically. That is, based on the observation of 15,000 cases I collected and documented so far. If you want to work conscientiously, you should check each case according to all 4 biological laws.
Perhaps we should go one by one. What is the second biological law you have found?
The second biological law of new medicine is the law of the two-phase nature of diseases.
All diseases, not only cancer?
Yes, all diseases of the entire medical system are in this two-phase system. In the past, in ignorance of these interrelationships, roughly speaking, we have seen 1,000 diseases. 500 of them were cold diseases, where the patient had narrowed skin vessels, was pale, lost weight. The others were 500 hot diseases with fever, dilated vessels, good appetite, but great fatigue. All these supposed diseases were considered to be diseases in their own right. Now we know that none of this was true. They were only half illnesses each, and consequently we now only know, roughly speaking, 500 diseases that are two-phase. The first phase is always the cold, conflict-active, sympathicotonic stress phase. And the second phase is always a hot, conflict-active, vagatonic healing phase, provided there is conflict resolution. In the brain, of course, the Hamer focus for these two phases are in the same place. We can also say that it is the same Hamer focus. In the conflict-active phase, it has sharp-shooting target rings, and in the healing phase, these rings dissolve into edema. From these examples, we can see that these biological laws, of which we will discuss the last 2 in a moment, are valid for the whole medicine, not only for cancer. Even the old deer, which is chased away from the territory by the young deer, is in constant stress and suffers a biological conflict, namely a territorial conflict, with a Hamer focus in the brain on the right, approximately above the right ear. The deer now races and thinks only of conquering its territory back. It does not eat, it does not sleep, it loses weight quickly because it is in constant stress. It has heart stings, angina pectoris. Organically speaking, ulcers, that is, small ulcers in the coronary arteries. And he runs at full speed. And as soon as he succeeds, by running at full speed, in driving his rival out of the territory and reconquering it, from that moment on he is in permanent vagatonia. He eats well again, a great tiredness comes over him, gains weight again, has hot extremities. At the peak of the healing phase, he suffers a heart attack, as an epileptoid crisis. When he has survived it, he is allowed to own his territory again. In the animal kingdom, this is the course of events, just like in humans. In the case of a man, the farm, his own business, His family or his workplace would perhaps correspond to his territory. With humans, we have several partial territories. Even a car can be a territory. In humans, you only notice the heart attack if the conflict has lasted at least 3 to 4 months, and it is usually fatal if the conflict has lasted longer than a year, and you overlook the onset of the vagatonic healing phase. A brain CT helps to diagnose this situation quickly. One could perhaps ask oneself why the physicians had not long ago recognized the regularity of the two-phase nature of all diseases, when the two-phase nature is so perfectly regular? The answer is as simple as it was difficult before. It was simply because only a part of the conflicts finds a solution. If the conflict cannot be solved, the disease remains single-phase. This means that the individual remains in conflict activity, emaciates more and more, and finally dies of debilitation or cachexia. Strictly speaking, the law of the two-phase nature of the disease therefore only applies if the individual can achieve a conflict resolution. Nevertheless, this law is optional for every disease or conflict, since in principle, every conflict can be solved in this or that way.
Dr. Hamer, what is the third biological law you have found?
It is the ontogenetic system of tumors and cancer equivalents.
What does the term ontogenetic mean?
The term ontogenetic here means that all diseases in medicine can be derived from the developmental history of humans.
How have you come up with this term?
I have observed a great many cases, up to the point where I discovered the ontogenetic system of tumors and cancer equivalents, about 10,000. And I worked as a good scientist should work, purely empirically. So I documented all the cases, collected the computer tomograms of the brain and the histological findings, and then I always put them all together and compared them. And lo and behold, a breathtaking result emerged that had previously been considered impossible. There was a system. There were many patients, in whom a compact tumor grew in the conflict-active phase, that is, a cell proliferation. And there were others, something grew in the healing phase, in the vagatonic phase, after conflictolysis. And that could hardly be the same. So there were two kinds of cell proliferation. One kind of cell proliferation in the conflict-active, sympathicotonic phase, and the other kind of cell proliferation in the healing phase, namely, in the diseases which had holes, necroses or ulcers, as we call them, in the conflict-active phase, cell fusion or cell loss. So this disease had a cell proliferation in the healing phase. Now I have compared these different manifestations again and again. And there I found, as I said, a system. The tumors that were formed in the conflict-active phase by cell proliferation always had their relays in the brain adjacent to each other, all in the brain stem and the cerebellum. These two parts of the brain together, we call the old brain. So, all cancers that reproduced cells in the conflict-active phase had their relays, their place from where they were directed, in the old brain. And all the so-called tumors, which are just an excessive kind of healing, which did cell proliferation in the healing phase, they were in the conflict-active phase, holes or ulcers or necroses. And their relays in the brain are always in the cerebral cortex. The realization of these connections was the birth of the so-called ontogenetic system of tumors and cancer equivalents in 1987. According to the iron rule of cancer and the law of the two-phase nature of all diseases, the very first systematic classification of all medicine. The term ontogenetic here means that neither the localization of the Hamer focus in the brain, nor the type of tumors or necroses, that is, their histological formation, are random, but that everything is very logically and understandably predetermined by the history of human development, in other words, ontogenesis. We say that ontogenesis is a recapitulation of phylogenesis. This means that the development of the different species up to the human being, in the embryonic period of the child and the infancy, is recapitulated. We now know 3 different cotyledons in embryonic development, which are formed during the very first development of the embryo, and from which all organs are derived. The inner cotyledon or entoderm, the middle cotyledon or mesoderm, and the outer cotyledon or ectoderm. Every cell or organ of the body can be assigned to one of these so-called cotyledons. The cells or organs that develop from the inner cotyledon have their relays, that is, their control site in the brain stem, in the oldest part of the brain. In the case of cancer, the organs belonging to this inner cotyledon multiply with compact tumors of the adenocell type. All cells or organs that have developed from the outer cotyledon have their control relay in the cerebral cortex, the youngest part of our brain. In the case of cancer, they all cause cell loss in the form of ulcer or ulcers, or a loss of function on an organic level, such as diabetes or paralysis. In the middle cotyledon, we distinguish an older and a younger group. The cells or organs belonging to the older group of the middle cotyledon have their relay in the cerebellum, that is, they still belong to the old brain and therefore, in the case of cancer, also make compact tumors in the conflict active phase, namely of the adenoid cell type. The cells or organs that belong to the younger group of the middle cotyledon have their control center in the cerebral medulla and, in the case of cancer, necroses or tissue holes, or cell fusion in the conflict active phase. For example, the holes in the bone, spleen, kidney, or ovary, called bone osteolysis, spleen, kidney or ovary necrosis. This shows that cancer is not an absurd event, an accidental wildly occurring cell, but a very well understandable and predictable process, which is precisely adapted to the ontogenetic conditions.
Growth, so it seems to me, is not equal to growth. Perhaps you can explain this different growth using certain diseases to make it clearer.
Yes, that is the reason why it was never possible to bring a system into the whole process of cancer development, because there was no system at all. According to the idea of the previous medicine, which was called conventional medicine, which I now call the medicine of the students, one had classifications, which had nothing systematically to do with each other. It was said that cancer is, when cells grow excessively. But, as we can see now, cells can grow excessively in very different phases. So in the conflict active phase, cells can grow, and in the conflict healing phase, cells can overgrow. For example, when a patient has an indigestible conflict, he has already swallowed a morsel, but now he cannot digest it. For example, he has already bought a house and suddenly he realizes that the purchase contract is invalid. He has been cheated, and he loses the house again. Then he can get, for example, a stomach carcinoma, a huge cell proliferation in the stomach. We call it an adenocarcinoma, a cauliflower-like growing adenocarcinoma of the stomach. He suffers this carcinoma in the conflict active phase, and the corresponding Hummer focus is located in the old brain, on the right side of the brain stem, in the so-called pons. Another case. A patient suffers a water conflict, which is a conflict with liquid, with water or similar. For example, when swimming in the Mediterranean Sea, a young patient loses his strength, almost drowns, and is rescued and revived in literally the last second. From then on, he dreamed of drowning for months and never wanted to go to the water again. In the process, he suffers from renal parenchyma necrosis cancer, then has necroses in the renal parenchyma, that is, in the renal tissue cell fusion, thus necrosis. Until finally all renal tissue is used up and the kidney is without function. When the conflict was finally resolved after years, because the patient's little daughter wanted to splash around at the sea so much and the patient took a vacation at the sea for the first time, a large renal cyst formed during the healing phase, that is, cell growth within the healing phase. And the original purpose of this cyst was, the cyst indurates, solidifies, let's say with a kind of connective tissue, but which has as its goal to become kidney tissue again and to excrete urine. In general, we have arrived at the question of what the tumor's original purpose was, or perhaps still is today. Namely, these cancers or tumors were not senseless, but they were something meaningful. For example, if the morsel is already in the stomach, meaning it has already been swallowed, but cannot be digested because it was too big, then the organism has created a huge tumor. But this tumor is not something senseless, but rather digestive cells, that is, intestinal cells that produce an enormous amount of digestive juice, and thus make this morsel digestible, so that the morsel can be brought down and digested, in the animal kingdom. And in the same way, we have just seen that this kidney cyst, originally had the sense to build a new large piece of kidney, which then can really excrete urine. So this is the sense of these different cell growth tumors, which we could not distinguish before, but now we can distinguish them exactly, which we can also distinguish according to the brain, which we can distinguish according to the histological formation, and which we can distinguish according to the conflicts.
And all these connections are summarized in this ontogenetic system of tumors and cancer equivalents?
After all diseases that we know of in medicine follow these four biological laws. They can be interrogated and reproduced according to these biological laws, and also according to this ontogenetic system of tumors and cancer equivalents. In the psyche and the brain, all phenomena in the same phase are the same. Only on the organ level do they differ. There the old brain-controlled organs show cell growth in the conflict-active phase, while the cerebral-controlled organs have holes, necroses, or ulcers in the same conflict-active phase, thus cell fusion. In the healing phase, everything then behaves exactly the opposite way. Here, the old brain-controlled organs decompose their tumors with the help of special microbes, while also in the healing phase the holes and ulcers of the cerebral-controlled organs are filled up again, with the help of viruses and bacteria, with swelling.
Here we are now, I think already at the fourth law?
Yes, the ontogenetic system of microbes.
Dr. Hamer, what role do microbes play in your system? In this context, we also hear a lot about the immune system.
Until now, we had only understood the microbes as if they caused the so-called infectious diseases. And that seemed to be a logical assumption, because we always found these microbes in the so-called infectious diseases. But that was not true. And the whole immune system was also just a big mirage of hypotheses. Because, in the case of these supposed infectious diseases, we had also forgotten, or overlooked this first phase. Because these alleged infectious diseases were always preceded by a conflict-active phase. And only with the resolution of the conflict, these microbes may become active. They are directed and activated by our brain. So they are not our enemies, but they help us, they work on our orders. On the command of our organism, directed by our brain. And they help us in the sense that they clear away the consequences of cancer that has become superfluous, that is, the tumor, which is no longer needed after it has fulfilled its task. Or in the sense that the bacteria and viruses help rebuild the holes, necroses, tissue destruction of the other group, the cerebrum group. So they are our loyal helpers, our guest workers. The idea of the immune system as the army fighting against the evil microbes was simply wrong.
In this context, tuberculosis or pulmonary tuberculosis comes to mind. What did the people have, who 50 years ago were still lying in sanatoriums, to cure their pulmonary tuberculosis?
If we leave plural tuberculosis aside for a moment and restrict ourselves to pulmonary tuberculosis, then we can say that pulmonary tuberculosis is always the healing phase after a previous round of cancer of the lung. This lung cancer always has as conflict the fear of death, and is always directed by the brainstem. Grows thus in the conflict-active phase, is diminished in the healing phase by the mycobacteria, the tuberculosis bacteria, if which are present, decompose and coughed up, often also with bloody sputum, which then again particularly shocked humans, and often led again to new death fears. So that we moved in a vicious circle. But with the animals, it works according to plan. The lung tumors are cauterized, coughed up and caverns remain, which have a much better breathing ability of the lung, than the lung had before with these compact round cancers. The lung tumors are cauterized, coughed up and caverns remain, which have a much better breathing ability of the lung than the lung had before with these round tumors. If, however, the tubercle fungus bacteria are missing during this healing phase, the round tumors remain. Today, we often still see these old lung tumors, decades later, which can no longer grow but are inactivated. In the past, we instead used to see many caverns, that is, emptied round focus, when tuberculosis fungus bacteria still existed ubiquitously.
Perhaps we are now getting to the practical therapy of conflicts. Is this primarily a talking therapy for you?
We can't say, but we don't need this talk therapy as it used to be in psychotherapy. So, you have to talk about any problems with each other. And of course, you have to. But let's look at the animal kingdom again. Because the animal can only solve its conflict, by real conflict resolution. So, the deer can only survive if it reclaims its territory. The animal mother, who has snatched away the young from the robber, can only survive if she either snatches the young from the robber again, or Mother Nature has an aid built in there. If this mother gets a new young again, as fast as possible, then the conflict is solved more realistically. And so we should try to solve the conflict in a real way with humans. That means to solve conflicts practically. A man, who has lost his wife, needs his wife back, or another woman. The deer needs its territory back, or another territory. The practical solution is always the best and most durable. Is a definitive solution? Only when this is not possible, then we humans can try to strive for talk therapy, quasi as a second best possibility, as an escape possibility, so to speak. But also here one must say right from the start that the therapy, which has always been used up to now for all psychological difficulties, has always been. You have to calm down. You have to switch off. You have to take tranquilizers, so that you become calm for the time being. In reality, however, Mother Nature did not program this stress in a senseless way, but only through the stress the individual could solve his conflict. And to find a real solution, you don't have to take away the stress from the individual, but rather increase it, so that he can solve his conflict. If one would give the deer tranquilizers, it would never be able to reconquer its territory. Instead, it would be paralyzed in its activity. We can see that in psychiatry the chronically ill are bred by administering tranquilizers, that is, chemical tranquilizers for immobilization. So that the wind has been taken out of these patients' sails, in any natural ability to solve conflicts. As a result, these poor people can never solve their problems again and often sit behind psychiatric bars for the rest of their lives.
Dr. Hamer, how does one work therapeutically with the 4 biological laws you found?
We must imagine that the patient has 3 imaginary levels: the psychological, the brain level, and the organ level. Although of course all 3 together form an organism. So the therapy should take place on these 3 imaginary levels, or extend to these levels. First of all, it is necessary to find the DHS, that is, to find this conflict shock including the conflict content, and to define it concretely on all 3 levels. One must work conscientiously and carefully. It is necessary to consider whether the patient is left or right-handed, to determine which of the 2 cerebral hemispheres the patient is working on. We also need to determine the current hormone status. For example, whether a patient is in the sexually mature phase, whether she is pregnant, or whether she is taking birth control pills, for example, which block the ovaries' hormone production, or whether she is in menopause. The same applies mutatis mutandis to men. This is because the hormone change can cause the side of the brain, on which the patient works to change. So a woman taking the pill may react in a masculine way, and may also have masculine needs and conflicts. A woman taking the pill, for example, usually reacts with a male territorial conflict, if her partner runs away or runs away from her territory. It is not only necessary to find the conflict on the psychological level, but also to locate it in the brain, according to the conflict phase we are in, at the time of the anamnesis and examination. And of course, this conflict, this cancer of the organ, must always have a clear correspondence to this Hamer focus in the brain. This means that every specific location in the brain always has to have cancer at a specific place in the body, and vice versa. We have already talked about the fact that the conflict must be solved, starting from the psyche. This is best done in real life. The conflict is based on a real problem. Thus the child of the mother, which is ill, which has an accident, must become as healthy as possible again. A man who has lost his job and therefore suffered a territorial conflict must either find another job or create a substitute territory by joining an association or by retiring, by devoting himself to a hobby. For each conflict, there are usually several possible solutions. In nature, many solutions are already programmed into the system. For example, in the past, many lambs were eaten by predators. The sheep mothers solved their conflict by quickly becoming pregnant again and giving birth to new lambs. Basically, in humans, The pregnancy stops from the 3rd month of pregnancy, any conflict, and no cancer can continue to grow, since pregnancy is an absolute priority in nature. On the cerebral level, we have most complications in the healing phase, when the local cerebral edema occurs as a sign of healing, when the cerebral pressure comes, and when we have to be careful that the patient does not fall into a coma, if possible. In this phase, coffee, tea, dextrose, vitamin C, Coca-Cola, and an ice pack on the head, as in grandmother's days, can help in lighter cases. In severe cases, the remedy of choice is currently cortisone in its tolerated retard form. Cortisone is not, for example, against cancer, but is a purely symptomatic remedy for brain edema and all organic edema in the healing phase. For example, against bone pain, caused by swelling of the periosteum. The general principle in severe cases is: drink little fluid, keep your head elevated, avoid direct sunlight, and if possible, do not lie on the side of the brain edema, if you have lateral brain edema. On the organ level, the only therapy that has been attempted so far has been to remove the tumor, or what was previously considered a tumor. No matter whether this tumor had grown in the conflict active phase or whether it was a healing phase cell growth. No matter. Everything was cut away. This level is now completely new. Once the conflict has been resolved, the tumor must, in the rarest cases, still be operated on or otherwise removed by radiation. But these are now only the exceptional cases. Healing cell growth tumors, as they should be correctly called, rarely require surgery, and only if they are mechanically very disruptive, if the patient feels significantly impaired by them, for example as in the case of a large renal cyst, or a large spleen that has formed during a healing phase following previous splenic necrosis. Spleen necrosis in turn was the organic substrate of a bleeding and injury conflict, with sinking thrombocytes in the conflict active phase, and in the healing phase with so-called splenomegaly, that is, an enlargement of the spleen. This means that we have to reshuffle the cards, so to speak. Based on the findings of the new medicine, we have to think carefully about what else we have to do, what makes sense, and what we no longer need to do. Because if we give a patient the choice today, of whether he or she wants to have a small intestinal tumor operated on, of which he or she knows for certain that the associated conflict has definitely been resolved, and that this tumor will therefore almost certainly never grow any further, then in 99.9% of cases the patient will, of course, tell us, "Doctor, let's leave this tumor where it is. It will not bother me for the next 30 or 40 years of my life."
Dr. Hamer, can you explain why the iron rule of cancer is called iron rule of cancer?
It is called iron because it is a biological law. Just as a biological law, for example, is that a child always has a father and a mother, so two are always involved in the process of creating a new child. So in the new medicine, we have 4 biological laws, which are quasi-iron. The first is the iron rule of cancer. The second is the law of the two-phase nature of diseases. The third is the ontogenetic system of tumors and cancer equivalents. And the fourth is the ontogenetic system of microbes. All these laws are iron, just like the iron rule of cancer. And all of them are reproducible in the strict scientific sense. That is, verifiable in any next best case. If you have a biological law, it only says that there is a rule of how something happens, according to which law. It does not say what you program into it. That means, according to the same mathematical rules, you calculate debts and credits. What is decisive is what the organism programs into it. If it programs the conflict resolution, that is, if the conflict is resolved, then the therapy runs almost automatically. If it cannot program this conflict resolution, that is, if this conflict remains unresolved, then this individual dies according to the same rules. Therefore, these biological laws are called iron biological laws.
What role does the factor time play in this context? Especially about the complications that can be expected during the healing phase?
The patient naturally asks the doctor, "Doctor, how long will it take approximately until my illness is cured again?" And here of course we come now, when we have worked well, found out the DHS and found out the time of conflict resolution, then we can calculate how long the conflict lasted. We can also find out how strong the intensity of the conflict has been, if we have a good history. And from this conflict duration and intensity we can estimate the conflict mass. And normally it is so, that in 90% of the cases no significant complications occur during the healing phase. The remaining 10% remain. Where the conflict lasted for a long time, the intensity was perhaps very strong, or both, and the patient therefore had a large mass of conflict, which can now make complications after the conflict has been resolved in the form of brain edemas and especially the epileptic or epileptoid crisis within the healing phase. This complication must be known. They are only really bad in 10% of cases. Can also occasionally lead to death. But since we know this now, and since we have been able to prepare ourselves for it in advance, and since we have been able to take countermeasures with our medication, especially with cortisone, these complications have largely become controllable. So that today we can bring patients through this healing phase, who would almost certainly have died in the past. Most importantly, however, with all these complications the patient now has a completely different attitude towards his or her disease. Because he now realizes that the doctor knows about the course of the entire disease, that is, the conflict active phase and the conflict resolution phase. And he can control every single intervention or every single therapeutic step in a really meaningful way and according to the situation. This builds up a great trust of the patient towards the doctor. And this is also justified. This means that we can now use the new medicine to treat in a targeted and knowledgeable way what we were unable to do in the past according to the old conventional medicine. By knowing the entire course of the disease, the patient hardly ever panics anymore. Who used to panic when the doctor told him he had purulent angina? Nobody. What was a purulent angina? Answer: the healing phase after a tonsil adenocarcinoma. Today, doctors are increasingly taking sample excisions from the tonsils and telling the patient, which is correct, that they have a tonsil carcinoma. The result is that the patient, who is not familiar with the new medicine, falls into total panic. This can be responsible for new conflict shocks, for example cancer fear panic, or fear of death panic, which then trigger a new cancer, which then apparently brilliantly confirms the doctor's initial diagnosis. And what happens in the animal? In the animal kingdom, we virtually never know the occurrence of so-called metastases. A professor from Klagenfurt once put it this way: the Hamer calls us all morons. He says, the animals are lucky. They do not understand the voice of the primaries. That's why they do not get metastases.
Are there no metastases in your opinion?
Clip and clear, no. Instead, what the ignorant medical students considered metastases were new cancers, based on new conflict shocks. That means first of all iatrogenic, that is, diagnosis and prognosis shocks triggered by doctors. The fairy tale of metastases was a fairy tale of nothing but unproven and unprovable hypotheses. Never before has a researcher been able to find a cancer cell in the arterial blood of a so-called cancer patient. Because that is where they would have to be found, if they were to swim to the periphery, meaning the outer areas of the body. Also the hypothesis fairy tales, that the cancer cells would have changed on their never observed way through the blood, on the way, and for example a colon cancer cell, which had made a cauliflower-like compact tumor in the intestine, would have suddenly migrated into the bone, where it could turn into bone atrophy are the bright insanity and of medieval dogmatism. The ontogenetic system has probably finally disproved that a cell, which was previously controlled by the old brain and made compact tumors, for example, suddenly leaves its associated brain relay, couples to the cerebrum, and suddenly produces cell loss. One can assume that about 80% of the second and third cancers are caused by the insane machinery of the current conventional medical pseudotherapy of the medical students.
Dr. Hamer, what role do the so-called carcinogenic substances play in cancer? Carcinogenic substances, or for example healthy nutrition? Can cancer be prevented or slowed down?
Carcinogenic substances do not exist. So many animal experiments have been carried out and never one really found out that a carcinogenic substance exists in any animal experiment. Of course, such idiotic experiments have been carried out, that rats have been injected with horrible highly concentrated formaldehyde into their noses for a whole year, which they normally avoid, and the poor animals ended up with nasal mucosa cancer. But they didn't get it from the substance, but because the poor rats disliked the substance, they suffered a conflict for the nasal mucosa. So a DHS, a biological conflict of not wanting to smell, we can put it this way. We also know that it is not possible to cause cancer in organs whose nerve connections to the brain are capped. Nevertheless, in the meantime, we have insanely looked out for almost 1,500 allegedly carcinogenic substances, which were only made into so-called carcinogenic substances by such idiotic animal test arrangements. This does not mean that all these substances must be non-toxic for us, but they do not cause cancer, at least not past the brain. After all, it was previously assumed that cancer is the result of the cells of an organ going wild by chance. All these ideas, that smoking causes cancer, or that aniline causes cancer, or something like that, are all pure hypotheses. They have never been proven and are unprovable. On the contrary, it has been found that 6,000 hamsters smoked with cigarette smoke lived longer on average than those who were not smoked, compared to 6,000 hamsters that were not smoked for 6 years. They simply had overlooked that gold hamsters are not afraid of smoke at all, because they live under the earth. Therefore they have no code in their brain, no warning light against smoke. With house mice, on the other hand, it is exactly the other way around. They get into total fear of death panic at the slightest smoke development and flee. In the Middle Ages, if you saw a swarm of mice running out of a house, you knew that it was burning somewhere. Thus, in some of these mice, smoking can cause lung cancer, which is caused by a fear of death conflict. These two examples may suffice to make it clear that almost all animal experiments that are carried out today are just senseless cruelty to animals. Because in all these experiments, the soul of the animal is regarded as non-existent. In short, there is no evidence at all for carcinogenic substances that act directly on the organ, past the brain.
So what about radioactive radiation?
The radioactive radiation released, for example, by the nuclear accident at Chernobyl, destroys body cells indiscriminately, but the germ cells and bone marrow cells are affected the most, because they naturally have the highest division rate. When the bone marrow, where our blood is made, is damaged and the body creates a cure, we see leukemia, which is the same as leukemia in the healing phase after bone cancer, which was caused by a self-devaluation conflict. So strictly speaking, we have to say that the blood symptoms of leukemia are nonspecific. This means that they do not only occur in cancer, but every healing of the bone marrow. The fact that hardly any of the leukemia patients have survived is merely because the last remnant of the remaining bone marrow was destroyed by ignorant conventional medicine, with chemo and radiation. So the opposite of what is necessary. In short, radioactivity is bad, destroys cells, but does not cause cancer, because it can only be induced in the brain.
And a healthy diet?
The healthy nutrition, which allegedly could prevent cancer, is also nonsensical. It goes without saying that a healthy individual, human or animal, is less susceptible to all kinds of conflicts. Just as the rich man gets about 10 times less cancer than the poor man, because the rich man can naturally solve many more conflicts with a thick checkbook. Thus also the strong and healthy animal gets naturally less cancer than the ill and old animal. That is natural, that is in the nature of the thing. But therefore age is not carcinogenic, but the old animal is simply weaker. The old deer is simply weaker and is chased away from its territory more easily than the younger deer, which is in bursting strength.
Dr. Hamer, what role does pain play in new medicine? In previous medicine, they were considered a negative sign.
Yes, pain is a particularly difficult chapter. There are different qualities of pain. Pain in the conflict-active phase, as in angina pectoris, or in the stomach ulcer. And the other group is the pain in the healing phase, caused by swelling or edema, or even scarring. Pain in the conflict-active phase, such as angina pectoris pain, disappears immediately with conflict resolution. These pains can, if you like, be solved psychologically. On the other hand, the healing pain, which in principle is something positive, can only be effectively tackled if the patient understands the connections and adjusts to the pain as if it were a real big job that he has to do. Of course, there are many ways to relieve the patient's pain medically and through external applications. Basically, pain in humans and animals has a biological sense. Namely, that the whole organism and the organ is immobilized so that healing can take place in an optimal way. For example, in the healing of bone cancer, where the expansion of the periosteum during the healing phase causes severe pain. Or for example, the liver capsule tension, which causes pain during the swelling of the liver, in the hepatic healing phase. There is also scar pain in the late healing phase. For example, the scarring of the pleural effusion, after pleural cancer. Or with the deridization of the ascites, which represents the healing phase after peritoneal carcinoma. The worst thing is that in current medicine, all patients who have cancer and pain, even if it is only mild, are given morphine or a morphine-like drug immediately. This morphine can be fatal in deep vagatonia with just one injection. It changes the whole brain vibration in a terrible way and takes away the patient's morality completely. From then on, the intestine is paralyzed as well. This means that food can no longer be processed, the patient is will-less and no longer notices that he is being killed, since he was already in the healing phase, and if things had gone naturally, he would have been healthy again within a few weeks. If you tell an inmate in prison that he is to be executed in 2 weeks, there is a huge vortex of pity, even for the worst criminals. But if you told a patient that you were now starting the execution in the form of morphine injections, which would be completed in a fortnight, he would rather endure his pain than be killed. When patients look back on the relatively short period of pain later, they are grateful that they were saved from morphine death, which they would have surely succumbed to, after 2 to 3 weeks of morphine, Voltaren, Valeron or Temgesic in the healing phase. Do the doctors not know this? They ask incredulously. Of course the doctors know this. They take the dogmatic and comfortable standpoint. Pain, that is the beginning of the end, there is nothing more to be done anyway. So let's start right away to shorten the matter. The natural healing of cancer is simply ignored for dogmatic reasons, so that cancer continues to be a terminal illness and the underage patient remains manipulable.
How could one summarize the most important aspects of new medicine? What is the central point?
The new medicine is a complete reversal of the previous hypothesis medicine. Conventional medicine needed 500 to 1,000 hypotheses and a few thousand additional hypotheses because it did not know anything at all, except a hodgepodge of facts, but always worked statistically. New medicine knows for the first time in the entire field of medicine, according to which biological laws our illnesses proceed. And it knows that they are not real diseases, but that these conflict-active phases are necessary, that they should help to solve a conflict that we had in the framework of nature, and that the conflict is something good for us. And it is now possible, for the first time, that we see our illness in a synopsis, in a total view. On the psychological level, the brain level and the organ level. Exactly according to these 4 biological laws, and medicine becomes for the first time again an art. An art for the doctor who has common sense and warm hands. The new medicine is unstoppable. Neither the new way of thinking, which is breaking down with it. The worst form of human enslavement, namely total alienation from oneself, will come to an end. The fear created by the total loss of natural trust in oneself and one's body, the abandonment of the instinctive listening to the voice of one's organism, will be removed. With the understanding of the connections between psyche and body, the patient also understands the mechanism of the panic, irrational fears of prognostically supposedly inevitable threats, which only become inevitable and mortal because the patient believes them. Because he is afraid. And so also, which from this fear of a supposedly self-destructive cancer mechanism, the allegedly infinite life-consuming metastasis growth etc., grown infinite power of the physicians. The responsibility, which in truth they never took and could never take over, they must now return to the patients themselves. This new medicine can mean real freedom for those who really understand it.
Dr. Hamer, what does the title of your book Legacy of a New Medicine mean?
I see the findings of the new medicine as the legacy of my dead son Dirk, through whose death I had fallen ill with cancer. I am administering this legacy to pass it on with an honest heart to all affected patients. so that with the help of this new medicine they can understand their disease and thus overcome it and become healthy again.